I'm Dr. Leslie Montgomery, and I am the Chief of the Division of Breast Surgery at Hackensack. As the Chief of the Division of Breast Surgery, my role is not only to be a breast surgical oncologist and take care of patients, which is of course my primary role, but I also help to devise the workflows and the processes and the policies that define our division, predominantly focusing on improving and maximizing the patient care experience and making sure that patients go through this difficult time in an efficient and compassionate manner. I had been at Memorial Sloan Kettering for 11 years, and I left Memorial to be the Chief of Division of Breast Surgery at Montefiore. And there we really built a breast center from scratch. There was absolutely nothing there. When I came to Hackensack, and one of the decisions that I made coming to Hackensack was again that same hope of really sort of strengthening. There was a breast center here, but strengthening the division of breast surgery, which would ultimately help to strengthen the entire breast service at Hackensack and increase the level of care for the residents of Bergen County. We see patients who have an abnormal physical finding that have been referred to us by their doctor, or an abnormal mammogram or ultrasound, so abnormal imaging. So they don't have a diagnosis, but there's something wrong physically or based on imaging. And then we move forward to do the appropriate workup and obtain whatever diagnosis that is for them. The other types of patients we see are patients who have been diagnosed, usually by mammography or breast imaging, so they already have a diagnosis of breast cancer, and then they come to us to gain our treatment recommendations for them at that point. So we really need to work with the patient to ultimately define the appropriate treatment that will, number one, cure them, and number two, since most women do survive their breast cancer, it's the decision that they'll live the rest of their lives with, and that they're comfortable that that was something that they were a part of. Every single patient that we see, every new breast cancer patient, is presented at our weekly tumor board. And in our tumor board, we have all the breast surgeons, all the medical oncologists, breast radiation oncology, genetics, social work, our nurse practitioner, our intake nurse, the tumor board registrars, and radiology. Together, we present what the plan is, and that needs to be approved on every single patient that we see on a weekly basis that is reviewed. Breast cancer is not just one disease. We know, as with many cancers, that a breast cancer can behave in many different ways, and they have different levels of aggressiveness and different propensities to spread, and the pace by which they are capable of spreading varies widely. I think it's important for us all to realize the importance of the patient experience also, and so seeing how that has really gelled over the last year, I'm very proud of the team that we have and the service we provide.